Welcome to the banker lamp. Please enjoy the video.
You start now. Confirm the doctor's clearance and identify plaster versus fiberglass because cutting technique differs. Once done, position the limb on a padded surface and drape to expose only the cast. Put on goggles and have an assistant hold the limb steady. You must control movement. Begin cutting along the cast's dorsal and ventral margins with a cast saw using short, light passes. This prevents heat buildup and avoids skin injury while maintaining steady pressure and patient reassurance. Continue carefully. Once both cuts run parallel, pause frequently and check for warmth or vibration transmitted to the skin, because overheating or pressure can injure soft tissue. Then slide a protective strip between cut edges and introduce the cast spreader. Twist incrementally to pry the shell open gently rather than forcing it. Make sure to keep communication with the patient. Ask about sensations while you work. If resistance persists, recut a small section and reinsert protection to avoid snagging bandage, or complete the procedure by separating and lifting away the cast halves while supporting the limb. Do this slowly to avoid sudden movement. Once removed, inspect skin, circulation, and underlying dressings. Look for pressure sores, new wounds, or retained debris. Clean and dry the area, apply any prescribed dressing or brace, and document findings for the clinician. If the patient reports severe pain, numbness, active bleeding, or you see exposed bone, stop and arrange immediate medical evaluation, because these are red flags.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.